for a healthier future.
Today we are going to talk about a very important topic: the early signs of heart disease. And why is it so important? Because heart disease is the #1 cause of death worldwide. And in the US alone, someone dies every 36 seconds. But here's the scary part. Heart disease often progresses silently and goes unnoticed until a sudden attack occurs. The key to defeating this silent enemy is to recognize the early warning signs. Your body sends you signals before you have a heart attack or stroke. However, these signs can often be overlooked because they are mistaken for ordinary ailments. Let's examine these signals together and learn how you can protect your heart health. 1. Constant stomach upsets. Another symptom that is not as common as classic symptoms such as chest pain is stomach discomfort. Complaints such as stomach pain, indigestion, bloating or vomiting are often associated with conditions such as food poisoning or a stomach infection. However, these symptoms, especially if they are unusually intense, may indicate an underlying heart problem. 2. Cough that won't go away. A persistent cough is usually associated with a cold, flu or bronchitis. However, this cough can be a sign of fluid accumulation in the lungs due to heart failure, especially if it is accompanied by abnormal symptoms such as blood in the sputum or if it becomes chronic. When your heart can't pump efficiently enough, blood can build up in the lungs, leading to a cough with shortness of breath. If you have a cough that won't go away, don't just assume it's an upper respiratory infection, see a specialist. 3. Cold sweats for no reasons. It may seem strange to suddenly break out in a cold sweat when you are not doing any physical activity. If your body reacts this way out of the blue, it could be due to inflammation around your heart. Cold sweating with chest pain is one of the most obvious signs that you are at risk of having a heart attack. 4. Anxiety and palpitations. Intense stress and anxiety affect both our mental and physical health. Research has shown that people who experience chronic anxiety over a lifetime have a higher risk of developing heart disease. Palpitations or irregular heartbeats caused by anxiety can be a sign that your heart is working overtime. Therefore, do not neglect your palpitations and consult a specialist to investigate the underlying cause. 5. Leg pain and cramps. A generalized pain or cramping sensation in the legs can often indicate a problem with blood circulation. This pain, especially if it starts when walking and goes away at rest, can be a sign of peripheral arterial disease. Peripheral arterial disease is a vascular disease that restricts blood flow to the arms and legs and is often seen in smokers or people with diabetes. 6. Swollen ankles and feet. It may be common to experience swollen ankles at the end of the day. However, if this swelling is persistent and accompanied by other symptoms, it may be a sign of heart failure. When the heart cannot work properly, fluids accumulate in the body, which often leads to swelling in the feet and legs. 7. Fatigue for no reasons. Feeling tired after a busy day is normal. But it's worrying when even a simple activity like getting dressed in the morning leaves you exhausted. Insufficient oxygenation of tissues due to poor blood circulation is one of the most common symptoms of heart disease. Women are more likely to experience intense fatigue, especially before and during a heart attack. Therefore, always consult a doctor in cases of unexplained fatigue. 8. Shortness of breath. Shortness of breath is a sign that your heart or lungs are not working properly. Sometimes this symptom can come on suddenly, sometimes it can get worse over time. Sudden onset of shortness of breath may indicate a serious heart problem. It is important to consult a specialist in cases of shortness of breath, especially during exertion. 9. Pain in the left shoulder or arm. The nerves of the heart and left arm can send the same messages to the brain. This can cause heart problems to be felt as pain in the left arm or shoulder. This type of pain is called reflected pain and is often experienced during a heart attack. Especially when these pains are combined with other symptoms, such as shortness of breath, you should seek urgent medical attention. 10. Sleep apnea. Sleep apnea, characterized by pauses and resumption of breathing during sleep, is a condition associated with heart disease. Over time, sleep apnea can strain your heart, leading to arrhythmias and heart failure. If you have symptoms such as snoring or waking up tired in the morning, you should consult a specialist for both your sleep and heart health. 11. Depression and mood changes. Depression is often thought of as a mental problem, but it can be directly linked to your heart health. Research has shown that people who are depressed have a higher risk of developing heart disease. In addition, symptoms of depression are more common in people who are predisposed to heart disease. If you are experiencing symptoms of depression, this can be a sign of both mental and physical health and should be taken into consideration. 12. Chest discomfort or pain. A feeling of pressure, tightness, burning or pain in the chest is often one of the most obvious signs of heart problems. However, this pain may not always be severe, and in some cases it may be mild. Chest discomfort, especially at rest or during physical activity, may be associated with heart disease. Never underestimate this kind of pain and consult a doctor immediately. 13. High cholesterol levels. While cholesterol is essential for our bodies to function properly, excessively high levels can increase the risk of heart disease. High cholesterol causes plaque to build up in your arteries, restricting blood flow, which can result in a heart attack or stroke. Keeping your cholesterol levels under control by having regular blood tests is vital for a healthy heart. 14. Decreased exercise endurance. Are you having difficulty with physical activities that you used to be able to do easily? If you are more out of breath when climbing stairs or tire more quickly when walking, this may be related to heart disease. Decreased endurance during exercise may indicate that your heart isn't working efficiently enough and you should consult a specialist. 15. Sudden or persistent dizziness. A feeling of dizziness or fainting can often seem insignificant, but it can be a sign that your heart is not pumping enough blood. Dizziness can be caused by serious problems such as low blood pressure, heart rhythm disturbances, or blocked arteries. If you experience this often, you should see a cardiologist immediately. By taking these symptoms into consideration, you can take control of your health. Protect your heart, protect your life. Remember, the most valuable treasure you have is your health. If you like our video, don't forget to like, subscribe and turn on notification for our new videos.